What if your body has been warning you about diabetes and you've been ignoring it every single day? Not next year, not last month, right now, today, this morning when you put your socks on. Before any blood test, before any diagnosis, before any doctor ever says the word, the signs may already be visible right on your feet. And what I'm about to reveal in the next few minutes could permanently change how you see your own health and the health of every person you love. Most people believe that diabetes can only be caught by a blood test. You go to your doctor, the lab work comes back, and that's when you find out. I understand why people think that. For years, that's what most patients told me too. And I've been practicing medicine for over 20 years. What I've learned, what I see confirmed in my office every single week, is that your body starts sending urgent, unmistakable warning signals about high blood sugar long before any lab result ever would.
And the very first place your body speaks up, your feet. The reason I'm making this video today is because of how many patients I've seen walk into my office, or worse, walk into an emergency room, who had every warning sign for months, sometimes years, and never knew what they were looking at. Today, I'm going to change that for you. Just last month, I sat down with a patient, a 71-year-old woman, a retired school teacher, active in her community, felt completely fine. She came in for a routine checkup. But before we did any blood work, I asked her about her feet. She told me her feet had felt strange for a while, kind of tingly and numb in the mornings. She figured it was just circulation from sitting too long. She had 5 of the 9 signs I'm going to show you today. Her fasting blood sugar came back at 228. She was diabetic and had been for over 3 years without knowing it. So today, I want to show you exactly what I showed that patient. 9 signs that were already on her feet and on millions of feet right now that almost nobody recognizes for what they truly are. For each one, I'll tell you what most people assume it is, what's actually happening inside your body, and one simple daily habit that can protect you starting tonight. The American Diabetes Association estimates that 1 in 5 Americans with diabetes don't even know they have it. That's over 8 million people walking around right now with a silent, progressing condition quietly damaging their nerves, their kidneys, their vision, and yes, their feet. The good news, a $12 blood test can catch this early. But first, you need to know exactly what to look for. So let's get into it. Sign number 1 is something almost every patient has already experienced, and every single one of them has explained it away. Tingling, numbness, that pins and needles feeling in the feet. My patients almost always tell me their foot just falls asleep sometimes. They were sitting with their legs crossed or in an awkward position. And yes, that happens to everyone occasionally. But I always ask them, is this happening regularly without any clear physical reason? Because if the answer is yes, we need to talk about what is actually going on inside your nervous system. Frequent, recurring numbness or tingling in the feet, what doctors call peripheral neuropathy, is one of the earliest and most reliable signs that blood sugar has been elevated for some meaningful period of time. The extra sugar circulating in your bloodstream begins attacking the outer protective layer of your nerves. It is a slow, silent, invisible process, which is exactly why most people miss it completely until the damage has been building for years. I use this analogy with my patients all the time. Think of your nerves like electrical wires running through your body. Every wire has a protective plastic coating around it. That coating is what allows the electrical signal to travel cleanly and accurately from your brain to your foot. When blood sugar stays elevated, it is like an acid slowly and relentlessly eating through that coating. The wire still works for a while, but the signals start getting fuzzy, distorted, and unreliable. And that fuzziness, that is the tingling you feel in the morning or at the end of a long day. According to the American Diabetes Association, peripheral neuropathy affects nearly 50% of all people living with diabetes. It is the single most common complication of the disease, and it almost always starts in the feet, which means right now, tens of millions of Americans are experiencing this tingling and writing it off as nothing worth mentioning to their doctor. My daily recommendation for every patient over 60, a 20 to 30 minute walk every single day. Not a jog, a walk. Consistent movement is the most powerful and most accessible thing you can do to keep blood flowing to your feet and actively protect those nerve endings. And start meaningfully reducing added sugar in your diet today. Not next month, not after the holidays, today. Sign number 2. And this one my patients describe as the most distressing of all because it does not hit them during the day. It hits them at night when they are alone, trying to rest, and there is nothing to distract from the sensation. Many seniors chalk burning feet up to being on their feet all day, or the summer heat, or general fatigue. And sometimes that is exactly what it is. But when a patient tells me their feet feel like they are on fire, especially when they are lying down with nothing touching them, I take that very seriously. Burning in the soles of the feet, particularly at night, is a classic and well-documented early sign of diabetic neuropathy. What is happening inside your body is this. The nerves in your feet have been damaged by excess circulating sugar, and now they are sending incorrect, distorted signals to your brain. Your brain receives a heat message even though nothing hot is anywhere near your foot. The nerves are misfiring, sending alarm signals for no external reason. Think of it like a fire alarm with a damaged, faulty sensor. The building is not on fire, but the alarm keeps going off anyway because the sensor itself is broken and cannot be trusted. Your nervous system is doing the same thing. The burning sensation is not coming from outside your body. It is coming from inside damaged nerve tissue that is desperately and urgently crying out for help. Research published in Diabetes Care found that burning foot pain is one of the earliest reported symptoms in patients later formally diagnosed with type 2 diabetes, often presenting 1 to 3 years before the actual diagnosis is made. Your feet were warning you long before the blood test confirmed it. 2 habits I recommend for this specific sign. First, drink at least 8 full glasses of water every day without exception. Proper, consistent hydration helps your kidneys flush excess glucose and directly supports damaged nerve tissue. Second, add more fiber to every meal without negotiation. Vegetables, legumes, oats, flaxseed. Fiber measurably slows the absorption of sugar into your bloodstream, which is exactly what those stressed and damaged nerves need to begin recovering. Sign number 3, and I need you to pay very close attention here because this is the sign that stops being uncomfortable and starts becoming genuinely, urgently dangerous. This is the sign that sends more patients to the emergency room than any other on this list. They come in and say they had a small blister from their shoe 3 weeks ago and it still has not healed. They waited. They assumed it would close on its own because small wounds always do. Most small wounds do heal on their own. But not when blood sugar is consistently elevated. When blood sugar stays high, your body progressively loses its ability to heal efficiently. The blood vessels throughout your body, including the tiny, delicate ones in your feet, begin to narrow and stiffen. This means that oxygen, white blood cells, and the nutrients your body uses to repair damaged tissue simply cannot reach the wound fast enough or in sufficient quantity. The wound sits there, open, exposed, and dangerously slow to close. Imagine trying to water a garden, but your hose has a serious, persistent kink in it. The water exists, the pressure exists, but it is not getting where it needs to go. That is exactly what high blood sugar does to circulation in your feet. The healing ingredients exist in your blood. They just cannot reach the wound. And an open wound that will not close is an infection waiting to happen. In a foot with already compromised circulation, that infection can escalate with terrifying speed into something that threatens far more than just the skin. The Centers for Disease Control reports that diabetic foot complications are among the leading causes of non-traumatic lower limb procedures in the United States, with the vast majority preceded by a small, seemingly minor wound that was ignored or dismissed. After your shower tonight, sit down in good light and look at both feet carefully and completely. Look between every toe. Look at your heels. Look at the sides of your feet. If you see any cut, blister, or area of broken skin, clean it gently with mild soap and water, apply an antiseptic, and cover it properly. And if it has not shown clear improvement within 48 hours, call your doctor. Not next week. 48 hours. Sign number 4. This one is hiding in plain sight. Most people walk past it every single morning without realizing what they are actually looking at. Patients notice their feet or ankles looking darker, more reddish, or slightly discolored, and they tell me it is sun damage, or they have always had that skin tone in that area. And that may be true, but there is a specific pattern of skin discoloration, particularly concentrated around the ankles, that I look for carefully when assessing blood sugar risk in any patient over 60. When circulation is compromised by chronically elevated blood sugar, the lower legs and feet simply do not receive enough fresh, oxygenated blood. The skin changes color as a direct result of that oxygen deprivation. You may see darkening, a deep reddish tone, or even a subtle bluish tint developing around the ankles. This is your skin communicating that blood flow to that region has become inadequate and that the tissue underneath is beginning to suffer. In some patients, the skin in those areas also becomes noticeably thinner and more fragile, another visible sign that the underlying tissue is not being properly and consistently nourished. I explain it to patients this way. Think of your blood as a delivery truck carrying oxygen and essential nutrients to every part of your body. Your feet are at the absolute end of the longest delivery route in your entire body, further from your heart than anywhere else. When the roads narrow because of blood vessel damage, the deliveries stop arriving on time. The skin, starved of fresh oxygen, changes color. It is a visible distress signal that you can see with your own eyes if you know exactly what you are looking for. A study in the Journal of the American Academy of Dermatology found that these characteristic skin changes are detectable on average 18 months before a formal diabetes diagnosis is made. The daily habit here: 5 minutes of ankle circles, toe raises, and calf stretches every single morning before you start your day. And if exercise is limited, elevating your feet slightly while seated can make a meaningful, cumulative difference over time. Sign number 5. This one surprises my patients the most because it looks completely harmless and cosmetic. Most people have had it for years and never once connected it to blood sugar or nerve function. They tell me their heels crack every winter and it is just dry skin. That is extremely common and I hear it constantly. But when your heels are cracking badly in the middle of summer, or when no moisturizer seems to help regardless of how consistently you use it, that is an entirely different and more serious story. Diabetes damages the autonomic nerves, the ones that silently control automatic functions you never consciously think about. One of those essential functions is regulating moisture and natural perspiration in the skin. When these nerves are damaged, the sweat glands in your feet stop functioning properly. Your feet lose their natural moisture from the inside out at the source in a way that no external lotion can fix or replace. Think of your skin like a wall that needs to stay perfectly sealed to protect everything behind it. When those autonomic nerves are damaged, the mortar between the bricks begins quietly crumbling. Cracks appear. And those cracks in the skin of your feet are not merely cosmetic concerns. They are open entry points for bacteria and infection. In a foot with already poor circulation, that infection can become genuinely dangerous very quickly. The American Podiatric Medical Association identifies chronic, treatment-resistant heel cracking as a significant and meaningful indicator of autonomic neuropathy in seniors, a condition directly linked to long-term elevated blood sugar. And autonomic neuropathy is not a minor inconvenience to be managed with better lotion. It is a sign that your nervous system is under serious, sustained stress. Moisturize your feet every single night before bed. Pure coconut oil or a good therapeutic foot cream works well. Apply thoroughly to the sole and heel. But never apply moisturizer between your toes, as that trapped moisture creates the perfect environment for fungal infection to take hold. I want to stop here for just a moment. We are halfway through these 9 signs, and I want to ask you something directly and personally. Have you noticed any of these signs in yourself, in your spouse, in a parent or sibling who you care about deeply? If the answer is yes, even just one sign, go to the comments right now and type the word yes. Just that. Capital letters. That is all I need from you. I read every single comment on this channel, everyone. If you have a question, ask it. If you are concerned, tell me. That is why this channel exists, not to talk at you, but to talk with you, person to person. And if this is helping you, hit the like button right now. It takes 1 second, and it helps this reach more seniors who need it today. Sign number 6, and this one is more serious than most people initially realize, because it is not just about your feet. It is about what is simultaneously happening to your kidneys. Almost everyone with this sign tells me they stand at work or sit at a desk all day. Occasional swelling from daily activity is completely normal. But if your feet and ankles are persistently swollen, and you are leaving deep sock indentations every single evening, that changes the clinical picture significantly. Chronically elevated blood sugar progressively affects kidney function, and your kidneys are responsible for your body's entire fluid balance. When kidney filtration is impaired by years of glucose exposure, fluid accumulates in the lowest part of your body because gravity is relentless and unforgiving. That swelling, called edema, is a visible sign that your body's most important filtration system is under real and serious stress. Think of your kidneys as the water treatment plant for your entire body. Every drop of blood passes through them continuously to be cleaned and balanced. When high blood sugar damages those filters over years, the system backs up. Excess fluid has nowhere to go except downward. You press your finger into the swollen area and the indentation stays there for several seconds. That is called pitting edema, and it is not something to observe passively and ignore. The National Kidney Foundation reports that diabetic kidney involvement affects approximately 1 in 3 adults with diabetes, and lower extremity swelling is frequently the first visible sign that kidney function is being meaningfully compromised. When resting, elevate your feet above the level of your heart, even a few inches on a firm pillow. This encourages that accumulated fluid to move back toward the center of your body. Reduce sodium in your diet consistently and read labels carefully, because many canned and processed foods contain shocking amounts of hidden salt. And if the swelling is new, worsening, or persistent, bring it to your doctor's attention at your very next visit without delay. Sign number 7. This is the one I see most consistently misdiagnosed, and by the time patients discover what it actually is, they have frequently been living with it for months and masking it with over-the-counter pain medication. What I hear almost without exception is this: I have been taking ibuprofen for the foot pain for a few months. I figured it was arthritis or maybe an old injury flaring up. I have heard this story dozens of times across my career, and sometimes that assessment is exactly right. But sometimes the pain has a completely different origin, one that ibuprofen will never touch and that masking only makes worse over time. When nerves are damaged by chronic high blood sugar, they do not always go quiet and numb. Sometimes they become hyperactive and erratic. Instead of going silent, they start firing random, intense, unpredictable signals that your brain interprets as severe pain. Patients describe it as stabbing, like an electric shock, or like a hot needle being pushed through the foot without warning. This happens most often at night when there are no other sensory distractions competing with the pain signals. A 2022 analysis published in the journal Pain Medicine followed over 4,000 adults over 60 with undiagnosed blood sugar elevation and found that 31% had been treating their neuropathic foot pain as arthritis or sports injury for an average of 14 months before the true underlying cause was identified. 14 months of masking a critical warning signal with pain medication that addressed nothing at the source. Think of a car alarm damaged in a minor accident. Every few minutes it screams for no reason. Nobody is breaking in. The alarm is just broken and misfiring. That is precisely what a nerve damaged by high blood sugar does. It sends urgent alarm signals to your brain when nothing external is actually happening. The pain is absolutely real, but its source is nerve dysfunction, not injury. And masking that signal with medication is exactly the wrong response when your nerves are desperately asking for help. Every morning, 5 minutes of gentle foot and ankle stretching before you get out of bed. Flex your feet, circle your ankles, pull your toes back slowly and gently. Get blood moving before you put any weight on your feet. And every night before bed, Give your feet a gentle 3-minute massage using light circular strokes along the sole and up around the ankle. Your nerves will respond to that consistent attention over time. Sign number 8. This is the sign that tells me how far the situation has actually progressed. When I see this in a patient, I know the damage is not in its early stages anymore. Almost every single time, the patient's immediate reaction is, "Doctor, I have had cold feet my entire life. My husband has been stealing extra blankets from me for 30 years, and I always smile with them. But then I ask, are your feet cold in July? Are they cold under 3 blankets when the rest of your body feels perfectly warm?" Because that is when I become genuinely concerned. Cold feet that persist completely regardless of the ambient temperature around you, cold in summer, cold indoors, cold under heavy blankets when the rest of your body is comfortable, are a strong and consistent clinical indicator of significantly compromised blood circulation in the lower extremities. Your blood vessels have narrowed or stiffened to a point where warm, oxygenated blood simply is not reaching the ends of your feet in sufficient volume. Think of your circulatory system like a heating system running pipes to every room in your house. When those pipes narrow from progressive blood sugar damage, the warmth does not make it to the far rooms no matter how hard the furnace runs. The room stays cold not because of the weather outside, but because of the pipes inside. Your cold feet are not about the temperature in your house. They are about the condition of your blood vessels. The American Heart Association identifies peripheral artery disease caused by narrowed, damaged blood vessels as affecting over 8 million Americans, with diabetes being the single largest contributing risk factor. Persistent cold feet in the absence of environmental cold are one of its earliest and most consistent presenting symptoms. The best response is a 30-minute purposeful walk every single day. Not a leisurely stroll, a brisk, arm-swinging, intentional walk. This actively forces circulation into the feet and lower legs, progressively strengthens blood vessel walls, and over consistent time can reverse some of the early narrowing that is causing the cold. Start with 10 minutes if 30 feels like too much. The important thing is to start today, not tomorrow. If this video is protecting your health and the health of someone you love, hit subscribe right now and tap the bell. Every week, new videos on the signs, symptoms, and daily habits that most people never hear outside a doctor's office. Do not miss a single one. Sign number 9, and this is the one almost nobody ever talks about. The one I have never once seen covered in a patient brochure or a standard health pamphlet. The one most people walk right past every single day, including many well-meaning physicians who are not specifically looking for it. Almost no patient ever brings this one up themselves. But during a careful, thorough foot examination, when I look at the lower legs and the tops of the feet, sometimes there is a visible, telling absence of hair in those areas. The patient looks down with genuine surprise and says, "I never noticed that." And that is precisely the problem. It is a quiet, easy-to-miss sign, but it carries significant clinical weight. Hair follicles require a steady, reliable supply of oxygenated blood and nutrients to function. When circulation is meaningfully impaired by long-standing elevated blood sugar, the follicles in your feet and lower legs slowly stop receiving what they need to sustain growth. Over time, quietly and without any pain or sensation, they stop producing hair entirely. That progressive hair loss is a visible, external marker of internal blood vessel damage that has been building in many cases for years before any other symptom became obvious. Think of hair follicles like small, living plants in a carefully tended garden. When the irrigation pipe slowly narrows or partially blocks, the plants do not die dramatically overnight. They just gradually, almost imperceptibly, stop growing and producing. The absence of growth tells you something critical about the health of the supply line beneath the surface. Research published in Diabetes, Obesity, and Metabolism found that hair loss on the lower extremities correlates significantly and reliably with peripheral vascular disease in patients with elevated blood sugar, representing a frequently overlooked sign that experienced clinicians are specifically and deliberately trained to identify and investigate. Right after this video ends, look at your lower legs and the tops of your feet in good light. If the hair is significantly thinner than the rest of your leg or entirely absent in patches, schedule a blood glucose test this week. Not this month, this week. Approximately $12 at any certified lab, covered by Medicare for most people watching this right now. $12 and one appointment could change the entire trajectory of your health and your life. We have covered a lot today. 9 signs, 9 real, visible, accessible chances to catch something before it catches you. And I want to be honest with you about something important before we close. One of the genuinely hardest parts of practicing medicine for over 2 decades is sitting across from a patient who has had every single one of these signs for 2 years, sometimes 3, and is only just now finding out why their body has been feeling wrong. Not because they did not care, they cared deeply. They just did not have the information. Nobody gave it to them. You now have that information. And I want you to do one thing with it, just one thing. Tonight, before you go to bed, sit down in good light and look at your feet. Take 30 seconds. Look at the skin color. Look between the toes. Feel for numbness or unusual temperature. Check for any wound or crack that should not be there. 30 seconds, that is all I am asking. And if you see or feel anything from this list, call your doctor tomorrow, not next week, tomorrow. Because the earlier this is caught, the more completely it can be addressed, in most cases through sustainable changes in diet, consistent daily movement, and an honest conversation with your physician. You worked hard for the life you have, for your independence, for your ability to do the things and be with the people you love most. Do not let something as manageable as blood sugar quietly take any of that from you just because nobody told you what to look for. Now you know. If you found this genuinely useful and important, share this video right now with someone you care about. A spouse, a parent, a neighbor, a friend. You might be giving them something they did not know they urgently needed. And if you want more honest, direct conversations like this one every single week, subscribe to this channel and bring someone you love along with you. Stay aware, stay proactive, and take care of those feet. I will see you in the next one.